Hey guys, it's Mark Cantor, interventionist. I want to do a video today on something that has come up a lot lately, and that is time is your enemy. And what do I mean by that? I get a lot of calls from families that have a son or a daughter or a loved one that is struggling with drug addiction. And I listen to these stories, and in some cases, I say, they need to move forward. But in other cases, I'm baffled because I'm like, I don't understand why they're not, calling me and saying, "Can you do this tonight? Where can we get my loved one into treatment?" They're eating fentanyl out of the package, or they describe circumstances to me where there's been overdoses, there's been trips to the emergency room, there's been all kinds of things, and they still want to procrastinate. Now, look, I know there are some situations where money is a factor. And if you called me and you said, I need to get my son, and you could show, or I understood that you didn't have the money, I wouldn't be a factor in that. If somebody needs help, let's get them into treatment. Let's get them the help they need. Nobody has to die because we're negotiating a price. But look, a lot of the calls that I get are from families that clearly have the means. They demonstrate that. They tell me they do. And yet they drag their feet on making this very important decision. It's interesting to me because, if somebody were having a heart attack, would you wait to call 911? Would you say, yeah, let's see what have you? If someone was clutching their arm and they couldn't breathe and they said they felt like an elephant was standing on their chest, you'd call 911 immediately. And the same is true with addiction. The emergency is just as bad. Look, addiction, untreated addiction, is fatal. That's why it fits the disease model. It's progressive, it's acute, it's progressive, and it's fatal if not treated. Just like a heart attack, right? I mean, I'm obviously not an expert in this field, but it has been explained to me that if somebody has a heart attack, the sooner they get medical attention, the better off, or the more likely of a successful recovery. And the same is true of addiction. So you may have an episode where your son, your daughter, your loved one winds up in the hospital from an overdose, and they go through that temporary moment of, all right, I'm not going to do that again, or this is clearly bad, and as a parent you say, well, I think they understand now, because logically, after doing something right and winding up in the hospital and having to be Narcaned or brought back to life, or whatever the case may be, it would make sense that the person would say, I learned my lesson, I'm not going to do that again. But that is not true with mental illness and addiction. It just doesn't work like that. I mean, over the years, I have heard story after story of people who get themselves into circumstances where, clearly the average person would say, they're not going to do that again, right? Who in their right mind would do that again? But addiction and mental illness, they don't follow a linear path of thinking, right? To me, in my experience and what I know about addiction, I see somebody in the hospital that's just been, their life has just been saved. I have no doubt they'll go out tomorrow and do it again, because I know the power of addiction. I know what this disease is about. And if you're someone that's well versed in addiction, you know too, right? So the minute something like that happens, the minute you catch your kid with heroin or fentanyl, or the first DUI call you get, or anything, take immediate action. It does not get better with time. Time is your enemy, right? So, I mean, I have received calls where I'm like, I don't understand where the hesitation is, right? I just don't understand where the hesitation is. And again, I'm talking about families that have the ability and the means, they have insurance, they have the means, they just have to make a decision and do something. And they don't even have to make a decision. They could call somebody like me and say, here are the facts, help us make this decision, or you decide for us, and I can do that. I can lead them through that process, or another interventionist can lead them through that process. But do not wait. I don't understand. So I've had interactions with families that they'll tell me stories where I'm like, stories where families are giving their kid $3,000, $5,000 a week or a month, and they're using it on drugs, and the kid is gone, the wife is gone, the job. What are you waiting for? What do you think is going to happen in between a heroin overdose and in a month from now? You think it's somehow miraculously going to get better. And I understand that you want it to get better. I understand that. And I understand that your son or daughter, your addicted loved one, wants it to get better. But without help, it is too much. That's what the big book of Alcoholics Anonymous says, right? These things never get better on their own, only worse. Guaranteed, ask anyone in the field. So what's going to happen in between a heroin overdose and bringing your kid home, right? Is it more trouble with the law? If you're lucky, the consequence is just that, right? But no, it's another overdose. But this time it's fatal. This time somebody didn't catch them in time. This time somebody didn't have Narcan with them. Time is your enemy. Do not waste this precious time. If you're in a situation where your son or daughter has had a situation where clearly they're struggling with addiction or mental illness or self-harm or suicidology, get them the help they need immediately. Take immediate action. Do not wait. Treat it as a medical emergency. It's like a cancer diagnosis. It's like a heart attack. Dial 911 immediately. Get them the help they need, because it never gets better. And let me tell you something. I just had a situation with a family where, against my better judgment, the family confronted the individual, and the individual said, yeah, I know I need to get help and such. And he may mean that sincerely, right? He may mean that very sincerely. But there's a big difference between him recognizing I need help and actually getting his butt in the car and going to treatment, or getting on the plane and going to treatment, right? Those are two different things. And let me tell you something. Addicts are masterful at giving you the Heisman, right? Don't come any closer. Don't look here, look there. It's not me, it's you, right? And, one of the tactics that I would use if I were an addict and I wanted to give myself some breathing room is I would agree with you. I would disarm you. I would say, yeah, I agree. I need help. I need to do something, right? Because that's going to automatically buy me a couple of weeks. So you back off. But what you really should say, if that's the situation, if you do confront your loved one, your addicted loved one, and they recognize that they have a problem, you should say, great. We need you to be somewhere in the next 24 hours, right? We need you to be on the plane tonight or tomorrow morning to treatment, right? It's not going to get better in time. This is not a fine wine. It's not aging. We need you to be on the... And if they don't, your next call should be to me or one of my colleagues in the field who's going to come in and get them into treatment. And don't get caught up on the fact that an intervention is an ambush or it's unfair or it's nonsense. It's not. It's not an ambush. It's a rescue mission. We're the ambulance taking you to treatment, right? Time is your enemy. Do not forget that. Take immediate action, right? If your son or daughter is struggling with addiction, take immediate action. Do not delay. Do not wait. Trust me on this. Talk to other people. It only gets worse with time. If you have any questions, I can always be reached at 202-390-2273. Thanks for watching this, and I look forward to your comments.